All right. Well, good evening, everyone, and thank you so much for joining me this evening. Yeah, my name is Mark Heelon. This evening, I will be sharing some medication tips that I hope you will find helpful. So, at the end of my presentation, I will be available for any questions that you might have. So, I was just going to share a little bit about me. I've been a pharmacist and had to bring out the calculator on this one, but I've been a pharmacist for 34 years. I really enjoy my profession, and time has gone by pretty quickly. So currently, my title is the Baystate Health Medication Safety Officer. And what I really enjoy about my job and why I went to school for pharmacy is helping people. And also, I have the opportunity to work with many different types of healthcare professionals, could be physicians, nurses, respiratory therapists, and you to help people be safe with their medications. So before my current role now, I used to work in a clinic where doctors would send me patients to help them with their medications. Medications, let's face it, can be complicated. For one thing, maybe called many things. There's brand names, generic names. So Motrin and ibuprofen are the same medications, but with different names. But what I used to get a kick out of back then is many of the patients thought of me as their private tutor, which made me feel good. So today I'm going to share with you some of the medication tips that I shared with the patients back then. So topics that I'll discuss this evening is number one is what is a pharmacist? So pharmacists receive extensive training and knowledge with medications when they graduate college. So I'm going to share some more details about a pharmacist and how they can be an important resource for you. I'm going to share some tips to help you remember to take medications. Also, some important tips around safely storing medications. Uh, Important points to help you or family members if you ever have to come to the hospital regarding your medications. And I'm going to share some tips for if there's any parents out there about administering medications safely to your children. And then lastly, some points on having your questions, being prepared before seeing your pharmacist or physician. Some important questions that you might want to have written down before seeing them. So, what is a pharmacist? So, pharmacists have extensive training and knowledge with medications. So, pharmacists are, I would consider, medication experts. They answer questions about medications from people like you, doctors, nurses, respiratory therapists, dietitians, and many, many others. So pharmacists today graduate with their doctorate in pharmacy, which can take 6 years or more to obtain. And many pharmacists continue to become board certified in certain areas and also partake in residency programs. So you'll hear of physicians in hospitals that are residents. We have pharmacists that are very similar, where we have a residency program. So pharmacists add layers of safety when reviewing your medication doses. For example, they may be looking at drug interactions, allergy conflicts, and they'll follow up with your doctor if they have any questions. But, please remember the pharmacist is working for you to keep you safe. The key message from this slide is a pharmacist is is a resource for you. So listed are some of the questions that you may ask your pharmacist. So think about some of these before you go in and pick up your next prescription. So make sure you know the name of your medication. As I said, they have brand names, generic names. Know the strength of the tablet, inhaler, or cream, or even a patch of how much you're taking. Make sure you really understand too of how often do I take this medicine? Is it once a day? Could be once a week. How do I take the medication tablet, or is it an inhaler? And if it is an inhaler or a different formulation, do you know how to take it? Would you know how to use an inhaler? The pharmacist can help you with this. Another question I've received in the past, is it okay to crush medications? For example, to place them in applesauce for easy swallow. Those are questions to ask your pharmacist. Make sure you know the reason why you're taking a medication. So it might be to help lower your blood pressure. Another common question pharmacists get are, what are the common side effects of your medications? And how long do I take a medication? So for example, an antibiotic, it might be for a certain duration, opposed to, let's say, insulin, which it may be an ongoing medication. So I'm remembering years ago, there was a patient that I was working with, and when I met with them, they stopped taking their blood pressure medications. And when I asked why, they felt that when they went to see their physician, after taking the medication, their blood pressure was normal. So they said, "Oh, I'm cured." And so they stopped taking it. And so I got to work with them and talk to them about the importance of continuing to take their blood pressure medications. Another question that pharmacists get often asked often is, what happens if I miss a dose? What should I do then? And then lastly, when should I expect the medication to begin working? Today, more than ever, you need to be an advocate for your care. If you have a question, please speak up. Today, you may see many different healthcare professionals. You have your primary care provider. You might see somebody for your heart, or a skin specialist, or somebody for diabetes. So what I'm gonna is going I'm gonna go over with you some important points to share with your healthcare professionals, all of them, and your pharmacist is part of that. So with everyone, share all your allergies to medications and foods and what happens when the allergy occurs. And ask the pharmacist or your doctor to add this information into their database so it's readily available. So if new medications are prescribed by other providers, that this information is readily available. Share with everybody the name of your medications, so including your prescription medications, over-the-counter medications such as antacids, pain relievers like Motrin, Tylenol, vitamins, laxatives, and herbal products. So when I used to be, as I said, a tutor before with medications, many patients would ask me about herbal products, and I would mention to them it's so important to let your healthcare professionals know about herbal products. Some of them may have interactions with other medications you take. So just be transparent about all the things that you take. This is especially important if you use multiple pharmacies. So pharmacies do not share the same database. Um, if it's one brand name of a pharmacy, yes, they do. But if there's different brand name pharmacies out there, there's not one governing database. So they may not know all the different medications that you're taking. And kind of on that note, I recommend using one pharmacy. So select a pharmacy that offers the most services, and also that you have a good rapport with your pharmacist. Using one pharmacy, all your medications can be entered into one database to help look for drug interactions for the pharmacist. And, another benefit too is, say you're in the hospital and the hospital has to reach out to your pharmacy to see what medications you're taking. If it's all at one pharmacy, they'll be able to get this information quickly and accurately for you. Share your medical history. So your heart doctor, say that you're seeing, may not know that you're taking insulin. And share which medications give you the most problems and why. Could it be side effects that you're having? Cost. Many medications are very expensive. So it's a team approach. How can we work together as a team to help you with whatever concerns you have with your medications? And ask yourself too, are you satisfied with medication? And if not, tell your doctor and pharmacist. Share, this is really important too, is share how often you miss your medications and be honest. So make sure you understand what happens if you don't take your medications. Excuse me. So I'm going to give you an example of a person that I worked with before. They mentioned that when they were asked by their doctor how often they miss their medications, they stated, "I never miss." And their blood pressure med they were on was all over the place. And so when I was meeting with the patient, I was kind of curious about that. And their response to me is, the doctor cares about my health. And I didn't want to disappoint them by telling them that I'm missing a lot of doses. So what happened was because the doctor didn't know they were missing the doses, they increased the dose of their blood pressure med, which would potentially could cause more side effects. So being honest is the best policy. And lastly, always speak with your doctor and pharmacist before stopping any medications, changing the amount you take, or adding any medications that they're not aware of. So I do take a medication for my blood pressure, and remembering to take medications can be can be hard. Um, you may need to set reminders to help remember to take them. So taking medications in relation to your daily activities. So if you get up in the morning and say you always put on the morning news, you can kind of schedule your daily medications in the morning. When you see the morning news, oh, that's a reminder for me to take my medications. So I help fill my mom's pill box each week. And what I do to help her remember to take it is in the pill box, she has a coffee every morning, and I place the medication pill box right next to the coffee machine so she doesn't forget her coffee. And when she sees that, it helps her remember to take her medications. And then I don't know if you can see these, but this is a smartphone. So a lot of people have smartphones now, and you can put reminders in these. I do that for myself. So you can put a reminder in there to remember to take your medications. Work with your pharmacy and ask about services they offer. So can the pharmacy have the directions on the prescription in your native language? So can it be written, for example, in Spanish? Some pharmacy offer things like pill boxes, or I call them bubble packs or bingo cards. And there's also some pharmacies that have home deliveries. So when I was involved with these bubble packs in the past, we would put the indication of the medication on a bubble pack, or say I had a person that was working with and they had troubles reading. We used to put pictures of like the sun and the moon on these just to get an idea about when best to take these. Also work with your doctor. So is this medication available to take once a day? You can ask that. Many medications now come in combination products. So there could be two drugs in one tablet. So there's an example, Zestoretic. There's two medications in that to which is used to help for high blood pressure. And ask, as I mentioned before, what happens if you miss a dose? What should I do then? And this is really important too, is call your pharmacy in advance when you go on vacation. Tell them how long you will be gone and when you need the medications. Don't wait like 4 hours before you're going on vacation. Um, so to give the pharmacy enough time to prepare for your trip. So storing medications. Medications in excessive heat and cold can have a significant impact on how well your medications work. And this includes prescriptions and over-the-counter medications. So medications like to be in a stored at a temperature between 59 and 77 degrees Fahrenheit, and they like a cool, dry place. So medicine cabinets, you think, well, it's called a medicine cabinet. It's a good place to store my medicines. It's not a good place because the environment in there, say if you have a shower, it can get very humid environment, which may negatively impact the way your medicines work. When traveling, never leave medications in a very hot or cold car, and don't store them in the trunk. I remember a patient I was working with, and they left their medications in a trunk. And literally, when they brought them back and showed me in the bottle, the medications melted into all together into one large, huge medication blob per se. And if you're traveling by air, keep medications in your carry-on luggage to avoid the extreme temperatures in the cargo hold. So medications that require refrigeration, such as let's think insulin or EpiPens, they should be kept in a cooler with a cool pack. And if medications are mailed to you at your home, see if somebody can be at home to receive them. Avoid having the medication sitting on a porch or in a hot mailbox. So medications also do not tolerate sunlight very well, and they can potentially lose their potency. So storing the medications on a windowsill is not a good idea. And be prepared. Have a plan in case your power goes out. As I said, some medications need to be stored in the refrigerator. So what would you do in that case? Expired meds. So medications can expire and potentially lose their potency. So one option is you can reach out to your town on how best to dispose of medications and storage of medications. Keep out of the reach of children and don't forget your pets too. And lastly, always inspect medications before you take them. If a medication is stuck together, it appears runny or is harder or softer than normal, if it shows changes in color or has a different odor than usual when opening the bottle, it may be compromised and should not be taken. Be sure to ask your pharmacist when picking up new medicines, what's the best way to store these? So it is very important to have an updated medication list going to and leaving the hospital. And share this list with all individuals involved in your care. So anyone really involved in your care, it could be your doctors, your nurses, and then also outside of the hospital, share an updated medication list with the pharmacy that you use. So this is very important to keep you safe. So you can take an index card. I have an index card next to me, a plain old index card, and include your name and phone number and a list of your medications on the index card. And keep this card on your person. So in your wallet, pocketbook, and on the card, so you list the name of your medication, the dose, how you take it, for example, by mouth, or is it a patch? Why are you taking it? So for high blood pressure, and how often you take the medication. But there's some other important things to include on this card. So include your pharmacy name and phone number. Add a family contact name and number. Also include your doctor's name or names and phone number. List any allergies that you have on the card. And this is something you may not think of, but also include your weight and keep this updated. So why weight? Many medications are dosed off of weight, and having that information can help keep you safe when they're calculating your dose. So when going to the hospital, bring medications with you in the exact bottle the pharmacy filled your prescription. Hospitals in general, which we have, it's called a formulary. It's a list of medications that we carry at the hospital. We will try to use those medications first because those medications we can put into our computer system and do, like I mentioned before, drug interaction checks to help keep you safe. The hospital may ask you to bring your medications home with you if we already carry them at the hospital. So to keep your medication safe at home. Inform your physician and pharmacy, and this is really important, after you leave the hospital about any medication changes. It is very important for you to update the medication list when you're leaving the hospital. Update that index card. So make sure you understand before you leave the hospital, make sure you understand the directions when leaving the hospital with the new medications. And I started this presentation off, you're your own advocate for your safety. So don't be afraid to ask questions. Show the updated list to your pharmacists and doctors after you leave the hospital. So, medication errors can occur after discharge. So what happens if a medication is stopped, say in the hospital? How would the pharmacy that you use outside of the hospital, how would they know that this medication is discontinued? So it's part with you by showing this list can help them update and make sure they have the most current list of your medications. So I'm going to share some tips for parents out there about administering medications safely to your children. So children are at increased the medication error. So why? So some of the reasons that place pediatric patients or your children at risk for medications errors include children's bodies handle medications differently than adults. Many medication doses for children are based on weight, and so they need to be calculated. So again, it's really important to have know their most current weight. Most of the commercially available products that you see out there are designed for adults, not for kids or your children. Children's liquid medication doses need to be accurately measured. So some tips for the parents. Keep a current list of all your child's medications, including prescriptions and over-the-counter medications, vitamins, herbal remedies, dietary supplements, and you place on that index card, like I said earlier. Carry a copy of that list with you. Include herbal supplements, over-the-counter vitamins. Provide pharmacies with your child's current weight and allergies when dropping off prescriptions. Include the information that I described before for a medication list. And ask your pharmacist for information on your child's medications. Be sure you know the following before you leave the pharmacy. So the dose, but because a lot of the doses are in liquid formulation, know the dose and how to measure it accurately. So I don't recommend using like a household teaspoon to measure medications. Work with your pharmacist. They can provide an oral syringe or a dropper used to especially measure liquid medications. If an over-the-counter product is packaged with a measuring device, such as a dropper, only use that device for measuring the medication that it came with. You ask your pharmacist, how long do I use this medication for my child? What are some of the common side effects? It's important to know how to contact your pediatrician after hours in case you have an emergency or a question. Notify your pediatrician if your child appears to be experiencing side effects from the medications. And store medications safely out of your child's reach or in a high shelf in the refrigerator if the medication requires refrigeration. So, vitamins should be treated like medications. I remember many questions before from parents. Many children's vitamin products look and taste, I would say, almost like candy, which can be dangerous. However, vitamin products may contain things such as iron and in other ingredients that could be harmful if a lot is taken. Um, Ask visiting family members to keep their medications out of the sight of your children. And never tell your children that medication is similar to candy or tastes like candy. Don't take your medications, your own personal meds too, my recommendations, in front of your children. Children, what they like to do is copy us. So they copy adults. So they may take the medicine or your medicine to copy you. Another thing that's really important to have is add the Poison Control Center phone number if you have a smartphone into your contacts or post it in your house if you have a home telephone. And make sure that your pediatrician, pharmacist, another one I just thought of here too is your school nurse are aware of your child's medications and allergy history. So a few additional safety tips. If you need help, consider having your doctor or your pharmacist write down your medications back down on like that index card that I was talking about before. Ask your pharmacist about help with high cost medications. Some medications can be extremely expensive. There may be generics out there. Um, so, opening up also with your physician, there may be alternative medications to use. And never be afraid to talk about some of these challenges rather than just not getting the medications. Um, a common thing that was asked of me before was, is it okay to use somebody else's medications or advice from a friend? I would get that question quite a bit. So my friend told me, or they heard on these late night TV commercials, that taking this product and buying this product will really help my condition, and it's okay to stop my other medications. So um, before stopping any medication, always let your physician and pharmacist know. Um, because many times sharing medications from family or friends can be dangerous, and just stopping medications or substituting medications also could end up being dangerous. So you have these experts around you and utilize them. Another thing that I remember too is I remember I had a diabetic patient and they were having troubles with their vision. So there might be ways. So when they were drawing up their insulin, they were having troubles reading the syringe. Make sure your pharmacist knows that. There might be some other options like these magnifying glass and so forth that can be attached to syringes to see if they can help you with this. And, to conclude my medication safety tips with you this evening, when you're leaving the pharmacy, check your medications. All of us can make mistakes, and all of us want to, we went to school and healthcare to help you, but mistakes can happen, and you're part of this medication, excuse me, of the healthcare team. So before leaving, look in the bag, making sure that the medications were filled correctly. Is there anything missing? So that's the time right then where you can go back and speak to the pharmacist. So I enjoyed talking with you this evening. I went over a multitude of different medication safety tips, and I like to open it up to anyone if they have any questions. Thank you.
Thank you, Mark. We appreciate all that expert information and tips. There were some really good ones in there, and I know I'm going to be making some changes myself. We do have a few questions in the Q&A, and I do invite anyone who is interested in posing a question, you can type them in the Q&A box. So the first question is there a legitimate website to check for drug and food interactions like warfarin and grapefruit juice, or food and disease interactions like licorice in people with high blood pressure?
Yeah, great question. So your legitimate website is your friendly pharmacist. I started this off talking about the years of school they went. You think about it, your pharmacist, they're readily available. When you go in and fill your medications, you typically don't have to, when you're picking up your medications, schedule an appointment, and they have a wealth of information. So I they have tools available plus the tool up here about the years of service. So I would recommend using their expertise before going out to different websites for interactions. I hope that helps.
Excellent. No, that's great advice. Um, so the next question is, what is compounding pharmacy?
Yeah, well, that's a great question. So compounding pharmacy, I'll tell you, for example, I'm more familiar. I've worked in a hospital setting for years, but I'll kind of do a little comparison. So when we purchase, and pharmacies too, when they purchase medications, they come from the distribution center, and they may come, say, for a particular medication, comes in a strength for, I'm making it up, like 10 milligrams. And this comes into common a lot for children and pediatrics. And say the physician needs for your child that this particular drug only is needed in 2 milligrams. So how are we going to do this? So in the hospital, we have a compounding section, and what they'll do is they'll take medications and prepare them. So like that 10 milligram dose that I gave you, and it's like the old chemist, the pharmacist that you see with the mortar and pestle. And there's certain, it's like recipes when you're in the kitchen and baking. There are recipes about compounding medications and putting appropriate ingredients together. So this new formulation is something that we would be able to change that, say that 10 milligram dose into something that would be more of a 1 milligram dose or something easily measured. So when you're working with your personal pharmacy, you can ask them if you needed a medication that needed to be compounded. So you might have troubles swallowing, or if the medication needs to be um, crushed, or if the pharmacy is not able to meet those particular needs, there are some unique pharmacies out there that have special compounding license, and you could work with your pharmacy to get a list of those available pharmacies that are out there. So I hope that kind of helps about compounding.
Interesting. There is another question about compounding. I guess this is regarding combination drugs. Where would you learn what drugs are available in that form?
Oh, combination? Yeah, the
Yep.
first, yeah. So I'll tell you, I take a medication for blood pressure. And I was taking it's a medication called lisinopril, and then medication. It's a long word, hydrochlorothiazide. And I talked to my physician about it, and I says, is there any common a medication out there where it comes in a combination? And there is. So the medication I take now is called Zestoretic, and both of those medications are in one tablet. So the first place you can start with to find out if a medication comes in a combination is your pharmacist. They would be the first place to start. And if they have some recommendations for you, you can bring that back to your healthcare provider who's ordering your medications for you and see if that's an option for you. Hope that helps.
Great. No, that's great. The next question is if you receive a medication and realize the form doesn't work for you, they use the analogy horse, but I imagine they just mean like a really large pill.
Mm.
Can your pharmacist provide it in a different form?
Yeah, so you remember I mentioned that your pharmacist is a key expert, like a relationship with you. And those are the questions you can ask. And that's a great question. All of these have been great questions. So knowing that any challenges that you might have about a medication, say swallowing a large medication, many medications come in all kinds of formulations. So asking your pharmacist if there's a different formulation, now you can go back or have the pharmacist maybe work with your doctor and prescribe this in a different way. I remember my dad has a medication. It was a calcium tablet, for his bones, and the medication there, the calcium is very large for him to swallow. And so he did work with his pharmacist, and they came up with another formulation that's easier to swallow for him, and it worked out wonderful. So great question.
Excellent. Thank you. The next question, if you miss a dosage, should you call your doctor or pharmacist about when to take the next dosage?
Yes. So real important. Uh, I used to get questions many times if, say, I forgot I'm taking a dose every day at 9 o'clock and I forgot it on Monday, and now it's Tuesday at 9 o'clock. Hey, Mark, is it okay if I double up the dose? Well, doubling up the dose is doubling up the dose, and the chances of you getting some serious side effects may occur. So it comes, so the person to begin starting that conversation with is with the pharmacist. There could be questions. So, are you late by, so if you take it every day at 9 a.m. in the morning, now it's 10 a.m. Is that okay to take opposed to the full day, on that? So, there'll be questions asked back to you, but ultimately between you, the pharmacist, you'll be able to come up with the best solution of when to take that med. And if need, we could, again, it's a team approach. We could reach out to your doctor to also get their expertise involved. But
Excellent.
doubling up doses, be cautious about doing.
Right. The next question, is there an extra cost to get the bubble pack you described?
Great question. And I think it depends probably on the pharmacy, and I'm going to be honest with you, I don't know. Um, so pharmacies, as I said to you before, I like recommending to use one pharmacy and to choose the pharmacy that offers the best services and the rapport with your pharmacist. And part of those services, say with the bubble packs, it's worth calling around to some different pharmacies to see what services they have out there and ask questions about bubble packs. Maybe one pharmacy, it could be free or not, or difference in cost. Could also, why you're, asking these questions, do they deliver meds? What other types of services do they offer? So, pharmacies we have in common where we want to help people, but the services may be a little bit different between them. So I would ask about cost.
Excellent. The next question, do prescription drugs ever contain fillers?
Yeah, so I'm kind of curious a little bit more about that question or why it was asked. Just kind of high level medications. When you look at a medication, so if you get the package insert, if you were to open up about a medication, they'll have a section in there about ingredients. And uh, the main ingredient that's in there is the active drug or medication that's in there. But there's other things that are in, say it's a tablet or a capsule that's in there, such as these fillers. So there's things such as binders, or there could be sucrose or different things in there. And what those things are in there for is sometimes to help the medications stay together. It might help with, stability of the medications. But why I think this is a very good question is with people with allergies, they may have some different types of allergies that potentially could involve one of the fillers. So the first place I would go if you have a question about a filler is ask your pharmacist. Ask your a doctor. Another thing you can do in conjunction with them is to look in that package insert in the section where it says ingredients, and you'll see the active medication, but you'll also see some things that are called inactive ingredients that include different fillers, etc. Hope that helps.
Excellent. Thank you. Yeah. The next question, she just has a personal experience about her pharmacy not being open 24/7, and she has high blood pressure and was making a cup of tea and it had licorice in it. And it was early in the morning before her pharmacy was open. And she thought it would be nice to be able to check, rather than to wait for her pharmacy to be open. But I do know at least one pharmacy that's open 24 hours, but that's probably not very common.
Yeah, and again, it comes down to the services. Like all of us, there's many healthcare providers out there, that there's many different pharmacies out there. And when you're looking around and if a 24/7 pharmacy is important to have that access to a pharmacist, that might be something that's really important for you to investigate and have that luxury of that expertise for you.
Definitely. The next question, what are the most common mistakes you see people make with medications?
Um, Good question. I would say I don't know if it's so the most common. I'm trying to just think of one, but I'll give maybe a few. So missing medications is a common I hate to say mistake. We're human, right? So these things can occur, and we want to do our best to set ourselves up to succeed. But missing medications um, is common, and so you have to figure ways to do that. And I gave you some helpful tips before. Listening to family or friends, mostly friends, about, geez, I heard this medication you're taking causes all these side effects. And, I'm your friend. I've known you for most of my life. And, you really shouldn't take this and stop taking it now. Or why don't you try one of my medications and see how you feel? I used to get those questions a lot, and that can be dangerous. So it's always important to advocate for yourself. And I believe your friends are mentioning these things because they care about you, but it's not necessarily in the best interest for you. So that's an important thing. And then run another thing too is running out of medications. So always be proactive. Don't call the pharmacy when you're already out of a medication. What happens if you need to get refills and stuff? So, try to be proactive.
Those are
Those are a few.
those are yeah, no, those are great. Thank you. The next question, beyond bubble packs and delivery, what other services are commonly offered that you're aware of?
Um, So my expertise again is not out in the retail setting, but that is a question. So with my parents, I started calling around with different pharmacies, and the bubble packs and delivery were things I asked. I also asked things about the pill boxes. Do would they fill medications in pill boxes, or how does that work? Um, so those are the more of the common things. And then I also just have an open-ended question for the pharmacist is, I'm really trying to, you know, um, help my child, my parents, myself, taking medications. Your pharmacy, what are some of the things that are unique about your pharmacy that may be a little bit different than other pharmacies? And it's an opportunity to really look at all the different types of services that are out there. Not everybody has the same exact services.
Yeah, that's an
So that's
excellent suggestion. Yeah, definitely. So it looks like this might be our last question, and it's really just a follow up to the question about the fillers. Uh, the person that asked about the fillers was curious about possible allergies in the fillers. I
Yeah,
guess
that's
if
what I was
that happens.
wondering if you were
Yeah,
thinking about. Yeah,
yeah.
so obviously, so medications do have fillers, and what I mentioned before, there's reasons to have those in there. There's, like I said, binding agents, for example, and to help medications with stability and so forth. So again, please check with your pharmacist and ask about, mention your allergies. Ask about the fillers that are in there. Are there other medications that or other brand names that are out there that have similar or the exact same ingredients, but may have different fillers? Then also I said be an advocate for yourself. Before taking it, you can also take a look at the package insert, look for the inactive ingredients, and see if there should be a list of the inactive ingredients, which would include the different types of fillers.
Excellent. Well, we appreciate you, Mark, for all the great tips and advice on medications. And we want to thank our audience for joining us and providing all those great questions. So thank you for your time and expertise, Mark. We
Yeah.
appreciate it.
Well, thank you so much, and thank you for the opportunity to share this with everyone this evening. I really had a nice time.